Hello and welcome to this talk today on the physiotherapy programme at the McGee campus in Ulster University. My name is Leslie George. I am the course director for the physiotherapy programme, and hopefully today I'll give you a bit of flavour of what it involves to be a physiotherapist, what it involves to be part of our programme at the McGee campus, and obviously we're very excited about the programme that we offer there, and hopefully I can give you some ideas about the excellent role that we play as physios and the role that's so important to many people's lives. Whenever I do these presentations, I like to outline this quote here about what physiotherapist involves. And certainly there certainly is more to life than simply breathing and having a pulse. We help to maximise the quality of life that our patients have, and really as a physiotherapist, certainly that does for many of us make us feel really fulfilled to be able to maximise the quality of life for our patients or service users. So as I go through this presentation today, hopefully I'll touch on the various different patients and service users that we as physiotherapists come across on a daily basis, and that we can really help and improve and maximise the quality of their lives. So what will we cover today? We'll cover what a physiotherapist is. Many people associate a physiotherapist as someone who works with athletes, who stands at the side of the pitch, but there's so many more different roles that we can fulfill as physiotherapists. So in turn, what future careers might you have as a physiotherapist? Why should you consider studying physiotherapy at Ulster University? What will you learn as part of the course? What will you be taught? And obviously, ultimately, if you're coming into higher education at university for the first time, how are we going to help support you in what is very much a new experience for you? So hopefully you'll get a bit of flavour as I go through this presentation today. So obviously we know that physiotherapy is a very caring profession, and anyone that comes into the role should hopefully have a very caring attitude towards their patients. Okay, it is a science-based profession. It takes a whole person approach, so not just any physical disabilities that the patient may have, for example, but also the psychological well-being of the patient. Okay, so this whole person approach to health and well-being, which includes the patient's general lifestyle. So obviously we do know as a population, unfortunately, becoming more sedentary. That is, we move less, and there's lots of health issues that can come with that. So we very much have a role in health promotion, promoting physical activity, and generally trying to prevent a lot of long-term illnesses as well. And hopefully, as physiotherapists, we can get that across to our patients and the people that we come across in our daily lives, and when they come to meet us and come to physiotherapy sessions. And generally, that's our all-encompassing role within the health professional field. Okay. So in terms of what a graduate physiotherapist looks like, so hopefully after the 3 years in our program, you'll be able to identify any problems that the patient may have that potentially need a solution. So whether that's a musculoskeletal, a respiratory, a neurological, and obviously much wider health problems that the patient may have, and what solution, how can you help that patient or that service user to overcome these problems, or at least help manage these problems? Can you source the relevant information within the literature? Obviously, it's very important, as you see here when I talk about critiquing and appraising that information. It's very important that we use the most up-to-date evidence. Okay, and obviously our course always is changing to try and include the most up-to-date evidence in terms of being able to manage our patients and the service users in the best possible way that we can. So it's important as therapists that we keep up to date with evolution and changes in practice. And obviously, as a graduate physiotherapist, that would be important for you as well. Okay, we need to identify solutions based on the evidence plus your own original thought. So sometimes things we may do as therapists may not be fully backed up within the literature, but we've used it in the past and it's worked with patients. So again, I suppose it's about being open-minded and being able to try different approaches with different patients. But for the most part, we use evidence-based practice, and we ensure that the treatments and the approaches that we take are the most up-to-date possible. compile and deliver reports and presentation in a way that can be understood by a variety of different audience. So for me, I obviously do presentations for potential students. I do presentations for undergrad students, for postgraduate students, that is qualified physiotherapists. And I also in the past have went to health promotion events for service users and patients. So it's important that you're able to tailor that information to the variety of different people that you come across within the profession. So in terms of what a physiotherapist is, you'll be an autonomous practitioner. You'll be able to practice independently, okay? And you'll be a safe practitioner. You'll be a critical thinker, okay? You'll be professional. We are underpinned on our professional bodies, ensure that we follow professional practice and guidelines. So as a therapist, you are a professional. It's important that you maintain those professional standards and that you act in a professional way to uphold the safety for your patients and also ensure that you promote the profession in a positive light. Obviously working as part of a team. So in the roles that I worked in within respiratory team, within ICU, within musculoskeletal, I work with a range of different professionals, whether that's general practitioners, GPs, whether that's nurses, whether that's occupational therapists, dietitians, podiatrists, health physiologists, different realms of nurses, whether that's district nurses, community nurses, and the list goes on. Clinical psychologists, the list continues to grow and grow in terms of the different professionals that I've come across in my working life, and it's important that you can feed into that and be an integral part of that team and be a good communicator within that team. Obviously, we want to ensure that you have very good clinical skills in terms of the assessment and diagnosis of various conditions, and that you have excellent academic quality so that you just don't accept research, for example, at face value. You write a dissertation, you will write assignments. So that means that you'll be able to look at the literature and look at the research and be able to appraise that research and work out if it's good research or maybe there's further research required. So why should you study physiotherapy at Ulster? So we are the first university that offered physiotherapy, as far as I'm aware, within the United Kingdom. But certainly, as you can see, there actually 1976, the first physiotherapy course in the UK. Okay, we are constantly keeping up to date with their skills. We come with a variety of skills from different backgrounds. Okay, we certainly do try our very best to support our students in the best way that we can. Okay, you will have studies advisors that will support you. We also have year tutors, and then we have myself as course director to try and ensure you feel really well supported within your role within Ulster University. In terms of innovative and practical teaching, we currently, our courses continuously need revalidated every number of years, and actually we've just started our new revalidation process for the programme. It ensures that we engage with key stakeholders, that is clinicians out in clinical practice, with our students, with our service users, in order to keep up to date and to continually develop the teaching. We do a lot of practical teaching on the course, and that's vitally important for you as a physiotherapist, that you come out with high level quality skills. So we've specialised training suites and industry spec equipment, innovative modules and assessment formats. So we use a range of assessments. So whether that's in an OSCE or whether that's a written examination, we try and use a broad range of assessments because certain students might feel more comfortable with different types of assessments. You will go out in placement across Northern Ireland, and you do have great graduate prospects. Obviously, we know that physiotherapists, like many other professions, are greatly needed within our National Health Service, and we try to produce therapists who can go out and work within the workforce. But also, if you choose to work in private practice or go further afield, we ensure that you come out with a broad range of different skills to help you to meet the needs and expectations of employers out there. Okay, you will go out in clinical placements. You need to do 1,000 hours of clinical placement across 5 placement opportunities, and you get to go out onto a range of different placements in order to develop the necessary skills required. Um, Obviously, we've just moved. This is our first year on the McGee campus in Derry, Londonderry, and our facilities include spaces, training and teaching hubs and learning spaces. They're fully functioning X-ray teaching rooms, skills labs, and an on-site podiatry clinic and healthcare hub. So we're all trying to be in this one site, obviously a multi-professional site, a multidisciplinary site, and we give our students the opportunity to work with different professions from different backgrounds. So that's vitally important as well. In terms of the general pros and cons of being a physio, it is a great career opportunity. Certainly, you do get to help people, which is absolutely fantastic. You do become a professional, and you do get to progress. And I've been very fortunate throughout my career to be able to progress through the different roles as a physiotherapist from a band 5, band 6, band 7, then all the way up then into academia. In terms of the cons, everyone has a problem in terms of staying professional whenever you're off duty. Obviously, that's vitally important as well. In terms of staying professional, it's very important that we all ensure everyone will have a problem, whether you're in a bar or whether you're night out or whether you're picking up your groceries from Tesco's. You will always be asked, what's wrong with my shoulder or what's wrong with something else. So it's vitally important to remember that as well in terms of maintaining professional integrity at all times. These salaries actually will probably change now in due course. Obviously, with we know that the professions in the NHS is going through restructuring in terms of their banding. But just to give you a rough, broad sense in terms of the salaries, in terms of the pros and cons. So a band 5 qualified, newly qualified physiotherapist will earn between 25 and 30,000 pounds per year. A band 6 physiotherapist, which means you're going working up through your specialisms. Okay, so a band 5 is usually a rotational physiotherapist who will gain experience in a range of different areas. Okay, as a band 6, you'll be starting to specialize in a certain area, whether that's respiratory, neurological, musculoskeletal. You'll be 31 to 37,890. A band 7 physiotherapist, which is more of a clinical specialist, will be between sort of 39,000 and 44,500. And a band 8A, which might be a first contact practitioner, it might be a manager, a clinical specialist, will earn between 45 and approximately 52,000 pounds. And obviously, with the current cost of living crisis and an increase in costs, obviously these are constantly fluid and are constantly changing all the time. So you might want to look online to get a more up-to-date assessment of the bandings. Okay. So in terms of the ever-evolving profession, when I came into the profession, I purely thought I would become a musculoskeletal specialist who would work on back pain, sports injuries, arthritis, joint pain, and that's what I came into the profession thinking. And I do work in that area, but there's so much more to being a physiotherapist. There's the cardiovascular side, working with patients with chronic heart disease in terms of cardiac rehabilitation. So patients maybe after a heart attack or who have got heart failure, etc. You may be responsible for encouraging these patients to exercise and to keep them fit and well. In terms of respiratory, this is another area that I have worked in, and my final role within the NHS was in respiratory, working with people with long-term conditions such as asthma, chronic obstructive pulmonary disease, cystic fibrosis, and again, encouraging these patients to clear their lungs, but also to encourage exercise promotion to keep them as fit as possible using what's called pulmonary rehabilitation. Neurological physiotherapy after a stroke, multiple sclerosis, helping people live longer term with Parkinson's disease, muscular dystrophy, motor neuron disease, the list goes on. And we have a vital role in helping to look after these patients from both the neurological but also respiratory standpoint as well. And there's evolving rules. I'm sure now you know when you go and ring up your GP, if you've hurt your back or if you've hurt your knee or your shoulder, very often you'll be referred to the first contact practitioner within the GP practice, which is a very specialised role, which takes a number of years to get that specialist role, but you're essentially an extension of the GP. You can prescribe medications if you're suitably qualified, and you have to go on and do a course in doing that. But again, you're in this specialist role, cancer care, respiratory care, and we are an ever evolving profession in terms of the different roles that we can fulfill. So what will you learn? Lots. It's an intense course, I'm not going to lie. You will be in university more than some other people who maybe do another course, but obviously it's vitally important that we produce physiotherapists who are going to provide a really high standard of care. I always look at students and think, would I be happy for that student to treat me if I were to take ill or to treat my loved one? And that's ultimately how we try and ensure that we produce high level, high quality students. So anatomy, obviously, is vitally important as physiotherapists that we understand our anatomy. Physiology, so how does the body work? Energy systems, muscles, how does that all work? Pathology, how can it go wrong? Why has someone got a sore shoulder? Why has someone had a stroke? How can we help this patient recover? Again, treatment, how can we help this patient recover from their sore back or their sore shoulder or their sore knee? How can we help them recover from a neurological condition? How can we help promote physical promotion? How can we reduce obesity through exercise, etc.? So again, it's imperative that we think about the psychology and sociology. Again, thinking about the whole body approach, not just the physical, but the psychological. What about our general academic skills? Research dissertations, writing up things, writing up projects, what research skills can we develop? Again, you might decide that you want to go on after you qualify to do a PhD. You might feel that research is more your field. So again, we try to develop these skills, particularly through all the years, but particularly in second and third year as well, so that you can interrogate the research and provide the, I suppose, the highest quality of care to our patients. So how will you learn? Well, obviously it's a very practical course. There's a lot of practical components to the course, very much face-to-face practical components. We've lectures, we've seminars. Some lectures and seminars may be remote for the most part. They will be face-to-face. We do try to use a blended approach whereby we may record some materials to allow you to go back and watch those at a later date. And students do respond well to that type of learning as well. So we have learned through COVID, and we have learned to listen to our students what they wish to have in terms of optimizing their learning. So again, different lectures, different module teams might use slightly different approaches, but I think that can only be a good thing for students in terms of mixing the learning up and seeing what learning style suits you best. There certainly is a very much a progression. In year one, it's very much directed, but as you progress through the years, you will develop much more into an independent learner. When you come into final year to do your dissertation, it's vitally important that you've developed those independent skills to be able to do your dissertation, to be able to look at the research. As you come in, if you come in straight from school, for example, you may not have developed those independent skills, but we certainly will hope that you develop these. So this is how the 3-year course looks at the minute. You can see here semester one. So it's split up actually. The university calendar split up into 3 semesters: semester 1, semester 2, and semester 3 over the summer then. But you can see we teach you the fundamentals in year 1. You've got a 1-week placement. You'll see at the top there, you've a 1-week placement there at the start of semester 2 or just before semester 2, and it's called orientation. So that gets you used to being on site. Then you go out in placement after your examinations in May of semester 2, running into the start of the summer. So that's a 5-week placement block, making up a complete 6-week block. In year 2, we continue to develop and we introduce new modules to you, and you've got a 6-week placement block, as you'll see there in January, February time of year 2. As you come into the summer, then you start to develop and come into summer, and you've got another 6-week block, and then you can see in year 3, then you've got 2 6-week blocks within semester 2, and you start to apply your knowledge, and you have a dissertation then to contend with then in year 3. So you can see how it develops. Very much your academic calendar and your timetable will be much fuller in year 1 and year 2 than it will in year 3 as you develop those independent learning skills. Okay, so it's important that you remember that. How will you be assessed then? Obviously something that people commonly ask. We use a variety of class tests, practical skills tests, which we call OSCEs. Okay, presentations, you might have to do a presentation, whether that's individual or group presentation. You might have to do an oral test, a video submission, an essay, and finally, in final year, a dissertation. So there is a range of different assessment skills. That's something that we like to do. It's something that the university likes to promote, because some people feel much more comfortable with different types of assessments. So we like to give a broad range of different assessments across the 3 years to try and get a nice even look at how you're performing as a student. So how will we support you? Vitally important. We do obviously take our pastoral care and learning support for students very seriously. You will be allocated a studies advisor who will contact you in line with Ulster University policy in terms of contacting you each semester to make sure you're okay. Obviously, you can go to them for support. You can go to the year tutor, or you can come to myself as course director as well. We very much have an open door policy. We have student support services, well-being services. We have placement educators, so you'll have linked liaisons when you go on placement. We have an overall staff member who looks after placement, but you also have educators out in placement, and you'll also have members of staff who will contact you to see how you're doing whilst you're out in placement, to identify any issues early and try and nip them in the bud if there are any. In terms of your online resources, they're available through Blackboard Learning, obviously university of resources that will help you in terms of managing those. And we have library resources. We set up sessions in first, second and third year to introduce you to referencing in terms of how to search databases, etc. as well. And that's built into your timetable and into the programme. Obviously, in terms of miscellaneous entry requirements, you need to consider looking up the entry requirements on the websites. We do have a dedicated admission team that does look after that. You will require medical examination and vaccinations, and it's very important that if you are successful in coming onto your programme that you do that in a timely fashion, or you won't be able to go out in placement. You need an enhanced police check, obviously, because you're going to be working with vulnerable members of the population. You will have to participate in practicals, so we do require you to undress suitably to be able to allow people to palpate or feel around your shoulder or around your knee, etc. And there is a large time commitment. So in each semester there's 60 credit points, and the way the university operates, for each 1 credit point there's 10 hours of learning associated with that credit point. So there's 600 associated hours of learning. So I understand people do need to have part-time jobs and to supplement themselves financially, but there is a good expectation that you have to put a lot of work in, again, to ensure that you provide the highest standard of care for our patients moving forward, and so that you can get the best learning opportunities as well. So you can see overall here, in terms of the overall program here, you can see the overview in terms of helping people affected by injury, illness or disability. We've talked about how you learn. We've talked about the teaching and assessment. We've talked about the real world experience with you having to do 1,000 clinical hours, and that's a Chartered Society of Physiotherapy requirement. You have loads of different career opportunities, whether that's the physiotherapists or researchers or rehab specialists. You can work in private practice in the health service. You can go on into management roles, and we are accredited and have to provide information every year to the CSP, and also we adhere to HCPC standards as well. So in terms of student comments of students who've done the programme before, you can see here from last year, as students said, I've truly enjoyed my first year. There's a lot to take on. I've said that there's a lot of hours to put on, to put in and learn at first. It can be a bit overwhelming. However, when I compare what I knew before the start of the year and now after just 2 semesters, it makes me want to know even more and continue my journey to becoming a qualified physiotherapist. Hard work and dedication is essential, but the support from the lecturing team is great, and they're always there when you need help. So again, we are there to support you as best we can. Another comment from a student in the physiotherapy course at UU is an immersive and exciting start to entering the healthcare field. With experience and supportive lectures paired with a dynamic environment, you're constantly challenging and growing as a healthcare profession. And that's really what we want. We want to challenge you. We want you to be innovative. We want you to be a critical thinker and to develop as a real therapist that can promote the profession and really look after service users and patients. Our courses are continuously reviewed and revalidated. As I said earlier, we are constantly going through the revalidation program, revalidation of our program. This happens every 5 years, whereby we have to ensure that we develop the course, that we listen to what students have said to our service users, our patients, and our key stakeholders within the NHS. And we're developing the course and we're changing the course currently as we speak. Okay, and that's an ongoing process to be completed next year. So modules may may change from time to time for your year of entry. So depending when you watch this, it's important to consider that as well. Look online for the most up-to-date review of the modules as you go through the 3 years, and please don't hesitate to contact myself. My details are on the website, l.george@ulster.ac.uk, but I am the course director for the programme. For any admissions-based queries, then please contact my colleagues in the admissions team. Obviously, we are very new on the Derry Londonderry campus. We've got the medical school there, we've got the nursing school there, and we've got the different ranges of courses within our school, within life and health sciences. But certainly, as a vibrant location, it's a lovely campus since we've moved there this year, and it's one of the most affordable places then to live in the United Kingdom. And obviously, we are developing cross-border links there where we are in Derry Londonderry as well, across into the likes of Letterkenny, etc. as well. As I said earlier, please contact the admissions team for any admissions queries. They are the best point of contact, particularly for more complex admissions queries, but all our entry requirements are published on the website. And if you need more information, please look up the web pages at ulster.ac.uk and study at ulster.ac.uk, and you can apply at UCAS. So hopefully that's given you a flavour, and hopefully I'll be seeing lots of applications coming through onto our physio programme. As I say, we do try to promote a vibrant course. We try and push you as a student, but really ultimately we want to produce therapists that will go out there and provide the highest standard of care to our patients. So thank you for listening and good luck. Thank you.